Mr. Chairman, I want to start first. I want to ask Ms. Simpkins a question, but that idea of transparency and information, to me, I don't know how you could say that wouldn't be good. I've been a proponent since I've been here that this place ought to focus as much on that as anything, because we're a portal that of information that if you collate it properly, that would seem to make sense. And I think that goes across the spectrum of healthcare as well. I've been the most vocal senator that our healthcare system is broken. We do not have transparency. We do not have competition. It's kind of almost like an unregulated utility, and you get your bill after you've had a significant healthcare scrape or a bad accident. You got to hold your breath to see how much it's going to cost, or you can afford it. So, like that idea. Mrs. Vessenmeyer, you mentioned that it was $7,200 a month, and it could have been more, and that's in Virginia, correct? Is that where the...
Yes, but that isn't the number that I gave you. That his room charge was $7,800 to start, actually $7,900 to start, and it cost me close to $13,000 a month.
$13,000 a month, okay.
That is correct.
That sounds unaffordable, so...
If he hadn't passed away rather quickly by the time, the length of time he was in there, it would have used up all of my nest egg.
That's the kind of stuff I've been appalled by from the time I took on healthcare reform in my own business 15, 16 years ago. How lucky the industry would tell you it's only going up 5 to 10% each year, in your healthcare premiums. Sooner or later, people can't afford it, and something's got to give. I was noticing in your background, Ms. Simpkins, you focus on low income because some people are going to be able to afford it despite the quality of care and the level, but most people will not. So in Indiana and the 4 other states where you operate, what would that range be per month as you'd compare it to $7,000 to $13,000 a month? And it seems like when it was all in, it was closer to that higher figure. Just curious.
Yeah, thank you, Ranking Member Braun. And the range that a resident or resident family would pay under the home and community-based services is really nothing. In Illinois, there's a small personal portion. It's based on resident income and allowing them to do things to still have money in their pocket. In Indiana, there's no personal portion, so the state of Indiana will pay for those services through the state.
So in your facilities, for low-income individuals, there's basically very little out of pocket? There's
very little out of pocket. There might be some personal portion based on what they actually receive in income, and it doesn't go over what anything a Social Security amount is.
And how much would you be able to generalize that across the rest of the country?
To model that program? Oh, you can model the program.
And are other states doing that?
There are other states that are doing it. Now, I will say that Illinois through the Supportive Living Program in Indiana are probably, and Ohio are doing it really well, recognizing that there's a need within their state. There's an underserved population. There are people that cannot afford it. And so that's what we were founded for. That's our business model, is to say there's an unmet need and how we're going to do it. And we work with states that have the programs, Medicaid waiver programs in place, along with rate reimbursement that makes sense.
So, Mrs. Vessenmeyer, you would not have qualified for any low-income opportunities then. Is that what kept you into what seems to be outrageous in terms of the cost per month?
That's correct, because even though we were both retired, they look at all of your savings. And if you have a decent IRA out there, that counts.
So it begs the question then, is the low-income stratum across the country being served adequately? That almost would seem to be surprising to me if that were the case. But what we're seeing on the other side, then it's a question, there just wouldn't be many families that could afford it. And, I don't know what the criterion or the cutoff is. Can you fill me in a little bit? Because it sounds like in Indiana, especially if there are other options to choose from other than just your organization, that the low to maybe middle income strata are being served well. Is that a fair statement or not?
That's a fair statement. Ranking Member Braun.
And do you think that is the case across the country as well as you know, because you serve on some boards where I think you'd have that information?
It's not across the country. So nationally, there needs to be programs in each state to provide access to affordable assisted living, and they're not all there yet.
Generally, and that's at least a little bit surprising. Generally, it's the folks at the other end of the spectrum, the low and middle, especially low, that don't get adequate services. So I think that's something that you need to get those practices spread out to where we at least can get that in most other states. And then you got to tackle something like this that I don't know how wealthy you'd have to be able to afford that easily and for a long time. Something's got to give there. I'll rest with that right now, and I'll have another round of questions if we do it.